We have a system that incentivizes profit over people, puts the price tag of a future product higher in value than the number of lives that it will save if it were affordable and accessible to everyone around the world. And then on top of that, the scientific community has never been under attack more. The United States government has turned from being one of the largest investors in basic science and biomedical research to try to cut major universities' funding for biomedical research, DEI programs, and so much more. Which is why it is critical that in this environment, in these moments, we support organizations like Universities Allied for Essential Medicines. I'm Justin Mendoza, Executive Director for Universities Allied for Essential Medicines, North America. UAEM was founded in 2001, and our single mission and goal was to make sure that universities are part of solving the access to medicines problem rather than causing or perpetuating that problem. But right now, we're in the fight just to make sure that universities have funding to be able to look at the future of biomedical research and make sure that we actually develop new medicines that can help people along the way. Despite the political turmoil currently happening in the United States and elsewhere, UAEM has been at the forefront of multiple huge changes that were only possible because of the amazing student leaders we are able to train and bring into the movement for access to essential medicines. In 2019, students at the University of California, Los Angeles were able to push forward what we call an affordable access plan, a policy that will make it possible for future medicines developed on university campuses to be affordable and accessible to more people around the world. That policy has now gone on to be implemented and discussed and added to agreements at more than 14 universities in North America alone, and critically, was a very fundamental part of the National Institutes of Health approach to affordable access planning for research done by the NIH. That plan is still moving forward. In October, we will see that plan and policy become final. So university students with UAEM and our allies were able to influence the beginnings of that process, weigh in later as it continued, and finally are about to see the U.S. federal government change its policies in a way that reflects the values of the students who first dreamt up this idea. Canadian students have been participating in dialogue with university leaders from across the nation, also contributing to the nation's policies and responses to a global pandemic agreement. The COVID-19 pandemic proved to us that the current system of biomedical research and development and incentives leave far too many people behind, rather than working on a solution that would make sure that medicine is always affordable and accessible to those who need them. Our student leaders get the chance to interact with world leaders, with politicians, and with each other to build community, grow the impact of biomedical research on the world, and critically, to fight injustice where it exists in a system that values profit over people. Your support can help us continue to fund and build the future generations of UAEM leaders that we need to solve the access to medicines crisis and make the entire world a more equitable and safe place to live. So I'm asking you to chip in today, whether it's $10 today, $10 a month, $25 today, $50 a month, or even $2,000, whatever you can to help us reach our fundraising goals so that we can continue to recruit, train, and retain student leaders from all over North America and make sure that their impact is heard and felt on the global stage. Thanks for listening. Please join our campaign. If you can't donate today, consider opening a fundraising page and asking your friends and family to donate instead.